My name is Michael Heller. I'm a Dr. Chiropractic. I work here with manual medicine in Schipheim, which is Switzerland and Entlebuch. It's a rural area, but I have a very interesting clientele. The bellicon actually came up by the question of a patient. They suddenly asked, "Oh, do you know about bellicon?" And I said, "No, what's that?" So they introduced it to me and gave me material, promotional material from the company, and I got in touch with bellicon and said, "Hey, is there anything that we get some sort of, scientific data that's backing up what you're claiming on your sheets?" So we got in touch. We set up with chronic patients, longer than 8 weeks of pain, be it neck pain, headaches, back pain, or vertigo. We included everything. So we said, okay, it has to be chronic, and we wanted to put them on an active program, 5 to 10 minutes a day for 3 months. And we also thought about how can we make that measurable. So I took some orthopedic tests, and we took questionnaire, an Western back pain questionnaire, which is validated internationally, and we set out, got the patients, had 25 going through those 12 weeks, and we collected data. The results of the study were surprising because we were really open. The most surprising part to us was orthopedic testing could not measure any change, but the back pain questionnaire clearly showed that the pain intensity, the level, significantly dropped. And the most surprising part was the drop was in the area which was activity of daily living, so and fear of that. So the patients were actually enabled to get back into their daily activities, which in the long term is the key issue, to keep them well functioning, quote unquote. And by using a bellicon, I have a tool that helps the patient on their own to keep that better motion longer available to the body to use it, because it decreases tension and it relaxes, possibly due to the nice swinging motion that really decreases tension. And if tension increases over a level of too high, then oftentimes we get pain. So by decreasing tension, we reduce the risk of running into pain. So when they do that, they prolong the effect of what I do on my part to help them feeling better. The change that's perceivable by a patient is very wide. Most people say it's a pleasure to use it because it just gives a good sensation of pleasure using it. And most people feel that their pain decreases, that they're having less tension, that also mental tension eases. And one patient was surprisingly saying she had not mentioned that she came into the study because of vertigo. And her vertigo hasn't really changed a lot, but she didn't tell initially that she also had a very serious bladder problem to withhold urine. And she was totally not going anywhere because she could not hold her waters. If anybody would make a joke, she'd say, be wet. And that changed with using the bellicon. So again, it's possibly not that the bellicon, which a lot of people think, yeah, I cannot go on a bellicon because my bladder wouldn't hold. Yes, if you go too vigorously, but that nice, gentle way of working on the bellicon really helped the whole tissue to relax and also the sphincter musculature to hold better. So this person really goes out again, is not afraid of somebody making a joke, or that she would have something that is surprised to catch her on the left leg. So it's really nice. I generally recommend all my patients to take part in the responsibility of their own health. And the bellicon is a very nice way to do so because, as I said, it's pleasurable to use. So, not everybody can go out and do vigorous jogging, but, standing for 5 minutes on a bellicon a day, I don't see a reason why nobody should be able to do that, or anybody shouldn't be able to do that. And it's very important that they take responsibility for themselves as well.